I think I was fortunate to early on be exposed to a lot of innovative pharmacists and also have the opportunity to do even directed studies at university where I was working on more clinical projects within pharmacy.
Innovation has been her forte. I first met her when she was part of the pharmacist network, I believe it was called, and we were doing something innovative about connecting telehealth with pharmacists, and it was one of the first paid services in the province.
I'm always thinking, what could we do next and how could we work together? I have a lot of friends in healthcare, and oftentimes our dinner conversations are about healthcare and the challenges and how we would love to solve them and make change and work together.
She's very passionate about the profession and really invested into making whatever role that she's in a successful one.
It would go beyond looking at, if you're working with a patient with chronic disease management, looking at, could you initiate a new therapy that might benefit them? Can you make a change? Can you do a referral? What more can you do to help optimize that medication for the patient so they don't have to go see another provider, come back and see the pharmacist, wait 2 weeks to go get a change? All of that could happen in one spot so they can access care right away when they need it.
Because of Allison, the delivery of pharmacy is better than it's ever been.
She's passionate about the little guys, always keeping in mind, rural and remote locations. I think that's really important because our colleagues are out there too.
Throughout my career, working in the small towns and rural and remote communities, a lot of the clients we served were also Indigenous. So I was learning about approaches to care in different aspects, where one time, I said to someone, oh, can you come back a little bit later? And then realizing they traveled 2 hours to come to this store. And so then it's like, how do you rearrange some of your flows to make sure that you can meet the needs of that person so they're not traveling 4 hours or coming back.
Her ability to really understand not only the experience of a community pharmacist, but being able to articulate that to stakeholders, being able to understand the value that pharmacists can bring to the healthcare system and how they work intercollaboratively with other healthcare professionals.
She also will go that extra mile to find out the information, that's needed to make a decision and to be informed.
I mean, anytime you care for a person and you're looking at their medications, you have to know what kind of symptoms they have. Is it the right thing you're treating or looking at? So being able to have the ability to support a patient with the medications they need does mean that you are looking at what conditions they have. So whether they've already been diagnosed and you're adding to it, or whether there's a minor ailment that you're looking at that you clearly know through looking at algorithms and asking the right questions as to what that patient needs and working with the patient on what would benefit them the most.
She's quite a trailblazer, I think. It's a really tough industry to be in when being a pharmacist and being a woman and going into industry.
I think one of the roles with leadership is really pushing others to excel and then taking learnings and sharing them with other people so that everyone can benefit from a change. And that's how we drive the profession as a whole to move up.
She's always been a proponent of scope of practice.
Where's the gap in care? Where is that need? And working with the physicians, even the local gyms and dietitians to see how we could collaborate, because in the smaller towns it was really easy to get to know everyone and look and see what can we do to help and work together. But you can also take that into the city too, because even in a city, you're surrounded by a group of people that are in your own little community. Even though it seems big, you can still make a little community in a big city.
The Leadership Award is quite appropriate for Allison because of the way that I hear her colleagues and people who work for her speak of her.
She's always looking outside of either the national borders or provincial borders for wherever she's practicing, and she's looking to see what's happening in other areas of pharmacy practice, but then also other healthcare professions. So she's bringing things back. She's great at building relationships with stakeholders, finding new ways to bring that innovation back to where she's working.
She's now instrumental in rolling out grants for clinics, pharmacist-led clinics, really the forefront of the profession.
No, I guess in my career, I've been very fortunate to be surrounded by great pharmacists that are willing to take what I say and apply it to practice and give it a try. And without people having that trust in me to try something new, none of this would roll out. And so it is having people have faith in your suggestions and ideas to run with it.